Hello to the best students in the whole wide world. This is Nurse Eunice with Florida Training Academy. And in today's video, we're going to be discussing tube feedings and nutrition. So as we do in each of our videos, we'll give you about 5 to 10 seconds to receive your notifications, and we will get started shortly. Hello, Shakira and Gerardo. All right, and everybody else, I'll be saying hello to you in the next few moments. All right, so let's get started. All right, so question number 1. What is the best position for a patient receiving oral feeding who is at risk of aspiration? Is it supine, the semi-Fowler's position, the high Fowler's position, or the Trendelenburg position? What do you think, lifesavers? We'll reveal the answer in 5, 4, 3, 2, and if you chose, waiting for my screen to catch up. Yes, if you chose C, you're absolutely correct. So the best response is going to be C, high Fowler's position. That's when your patient is sitting upright. It's going to be 60 to 90 degrees. You can put a pillow behind their back to help assist them sit upright. But sitting upright during meals helps to prevent aspiration by keeping the airway open and reducing the risk of food entering the lungs. All right, let's go to question number 2. And my chat is not working. So if you are putting comments in the chat, I will refresh it shortly. But for right now, it's not showing me any comments. All right, so question number 2, team. What is the purpose of thickened liquids for patients with dysphagia? Is it going to be A, to make swallowing easier and prevent aspiration? B, to increase hydration? C, to improve taste? Or D, to reduce the need for feeding assistance? There we go. I had to refresh my chat, and now I see everybody. Hello, my friends and family. Great to see you all. All right, and let's see what the responses are. Looks like Wadelin says A, Shelda says A, Sharon, lovely. And let's see, it's so many of you all. Princess, don't be nervous. You're taking your test tomorrow and you're going to do well. I know you will. All right, everybody, revealing the answer. And there we go. It is A, to make swallowing easier and prevent aspiration. So this is an example of a thickener that if your patient has been prescribed, so they go through like a whole swallowing evaluation. And so if your patient has been prescribed a honey thick, a nectar thick, they'll tell you the consistency. This is what you would add to their liquid. So this is the thickener. So thickened liquids move more slowly through the throat, thus reducing the risk of aspiration. All right, question number 3, everybody. Wadelina's taking her test on Friday. I am so excited for you all. I know it's nerve-wracking, but I know you're going to do well. All right. So, all right. Question number 3. What should a CNA do if a patient coughs while eating? Is it going to be A, lay the patient flat to prevent choking? B, encourage the patient to continue eating? C, offer water immediately? Or D, stop the feeding, encourage the patient to cough, and notify the nurse? You're so welcome. I love being here and I love being your global educator. I call it a classroom without borders. So right now, even though I'm sitting in Jacksonville, Florida, I'm also in Dubai. All right, question number 3. The answer is D. You have it. Yes. So stop the feeding, encourage the patient to cough, and press that button and get that nurse in the room. So if a patient coughs while eating, it may indicate difficulty swallowing or risk of aspiration. The best action is to stop the feeding immediately to prevent further choking or aspiration. Encouraging the patient to cough helps to clear the airway, and then notifying the nurse ensures that the situation is properly assessed, and if necessary, that this patient gets a swallowing evaluation. Chances chances are maybe they were eating while distracted, or you had them reclining while you were feeding them. And then when they start coughing, that's when you want to sit them up. Nope, just sit them up from the beginning, and that is going to make your life easier. Hey, Crypto, you take your test tomorrow also. And yes, we're sending you prayers. You all are amazing, and you're going to do well on your test. All right, so I do want to stop for a moment because Elizabeth sent this to me. It was so sweet. So Elizabeth, thank you so much for thinking of Nurse Eunice and sending me a gift. I just, really value, I love the fact that I can be here with you all online, but the fact that some of you all go out of your way, and whether it is a $3 super chat, a cup of coffee, you all just make sure that you let me know that I'm loved and appreciated. So thank you. Thank you to all of you all, and especially Elizabeth, because I love my necklace. All right, so question number 4, everybody. How long should a patient remain upright after eating to prevent aspiration? Is it 5 minutes, 10 minutes, 10 to 20 minutes, or 30 to 60 minutes? How long do we sit these patients up? Ooh, I see a mix of C's and D's, but looks like the D's have it up. Now we have a B. So you all, in order to properly allow the food time to digest, we want to at least wait D, 30 to 60 minutes. So keeping the patient upright for 30 to 60 minutes allows gravity to help the food down the esophagus. We call that the food pipe. And then it prevents reflux. Reflux is when that acid starts to build up and now the food comes back up and it can go down into the trachea and enter the lungs. So we don't want to lay them back until they've had proper time to allow their food to digest, thus reducing the risk of aspiration. So great job if you knew that. Question number 5. What is a common sign of aspiration in a patient receiving oral feeding? So this is somebody, because we're going to talk about tube feedings next. So this is somebody who is taking in intake orally via the mouth. Would a common sign of aspiration be sweating, coughing, clear in the throat, or wet lungs, a wet sounding voice, increased appetite, or high blood pressure? What is something you would recognize if your patient started making these signs that would alert you to, hey, maybe this patient isn't swallowing properly? And yes, my team has it. I knew you would. I didn't think anything less. So yes, it is B. These symptoms suggest food or liquid that may be entering the airway. And we know what to do when that happens. So we're going to stop the feeding, encourage them to cough, and press that button to get the nurse in the room. Question 6. A patient with a swallowing disorder should avoid which type of food? Is it pureed foods, mashed potatoes, soft scrambled eggs, or thin liquids? If a person's having a hard time swallowing, what should they avoid? I am so proud of you. And the nurse goes wild. Almost everybody got the answer right. It's not C. Give me a different answer. All right, everybody. So for 6, the best response is D. Look, if they're having, remember we just talked about that thickener? So if they're having a hard time swallowing, we're not going to give them something that can just easily flow down and it can enter their trachea, thus enter their lungs. So usually we thicken their liquid. So the soft eggs, if they're scrambled, I think the other option was mashed potatoes. Those things, because they're a bit thicker, they're going to be safer for them to swallow. Thus, thin liquids move too quickly and can enter the airway. So we're not going to give them thin liquids. Question 7. What is the most appropriate action? Hold up. Congratulations, D. We are so proud of you. Everybody give D her applause. Great job. All right, so question 7. What is the most appropriate action when assisting with tube feeding? Is it A, keep the patient lying flat? B, increase the feeding rate to speed up completion? C, keep the patient elevated at least 30 to 45 degrees during and after feeding? Or D, clamp the tube after each SIP, and this is referring to tube feeding. So if you've never taken care of a patient with a gastric tube before, this video is for you because we want to make sure that you understand how to take care of patients with specialized nutritional needs. And looks like everybody got the answer right. It is, drum roll please, it's C. You all have it right. I hope you're as proud of you as I am of you. So whenever someone has a tube feeding and there's actually food and they're being fed. So in the hospitals, we may have them on a pump for a continuous feed, but in like some of your long-term care facilities, we may allow a gravity feed. So you'll learn those differences in a few moments, but we need to keep the head of the bed elevated, but we don't keep them all the way up at 60 to 90 degrees because that's going to put too much pressure on their butt and they could get a pressure sore. So elevating the head prevents aspiration and allows proper digestion without causing other issues such as a pressure sore. So 30 to 45 degrees will be fine for that patient population. Question number 8. Maria, a nursing student who also works as a CNA, is assisting in the care of Mr. Johnson, a patient with a nasogastric NG feeding tube. During morning rounds, the nurse asked Maria to check the residual volume in the feeding tube before the next feeding. Maria is unsure if this task falls within her scope of practice as a CNA. So here are our options. What should Maria do when the nurse asks her to check the residuals from a feeding tube? Remember, the person has a nasogastric tube. So that's a tube that's going from the nose down into the stomach, and that's how they're being fed right now. Should she A, politely inform the nurse that checking residuals is outside the CNA scope of practice and decline the task? B, attempt to check the residuals to help the nurse as she's also a nursing student? C, ask another CNA how to check the residuals and then proceed with the task. Or D, flush the feeding tube with water first before checking the residuals to ensure accurate measurement. Look, I couldn't trick one of you all. You all understand that that's not within your scope of practice. That's a nurse's duty. So the answer is A. You all cannot check residuals. So CNAs are not trained or legally permitted to assess residual volumes in feeding tubes, as this is considered a nursing assessment. Even though Maria is a nursing student, her role as a CNA dictates her scope of practice, which does not include checking residuals. The appropriate action is to politely decline the task and remind the nurse that this responsibility falls within the scope of practice of licensed nurses. And remember, that could be an LPN or RN. But great job, team. Question number 9. What is your role when it comes down to tube feedings? Is it A, adjusting tube placement, B, administering medications through the tube, C, changing the formula when needed, or D, assisting with patient positioning and reporting issues? And you're doing so great with this practice test until I know you're going to get this answer right also. And yes, Priya and Jutlin and Rose and Miriam and Cassandra, it is D. So you get those vital signs, you do your job, you monitor that patient for maybe some gastric upset, for nausea, for vomiting, making sure their head of the bed isn't too low, it isn't too high. But that is your responsibility. You're assisting with positioning and reporting issues. The other stuff goes back to the nurse. Question 10. A patient with a gastrostomy tube, this is a fancy way of saying G-tube or gastric tube, they complain of nausea and abdominal distension. What do you do as the CNA? Do you A, raise the patient's head, B, lower the patient's head, C, pause the feeding and notify the nurse, or D, massage the patient's stomach? Oh, Miss Miller, I know your stomach hurts. Let me just keep these feeding going in and let me just massage your stomach to help the gas pass. Yes, everybody. So as a CNA, you can pause the pump. That is usually one thing that they're going to teach you in most facilities. And the reason why you have to pause the pump is because let's say you're repositioning your patient, you have to give a bath. But remember, I talked about continuous feedings that will happen in most of your hospitals. So this patient's on a continuous feed. So they're being fed sometimes 12 or 24 hours a day. You still have to turn this patient every 2 hours, but you know that if you turn them and you have to lay the bed flat and the feeding's going, you're increasing their risk of aspiration. So what do? You don't stop the feeding, you pause the feeding. And the machine is like, it's annoying because it will alarm. Like if you pause it for longer than 5 minutes, it's going to alarm to remind you to restart it. So most of your facilities will allow you as a CNA to pause the feeding just long enough for you to complete your tasks, such as repositioning. And I do apologize. It's a lot of noise outside of my office. All right, so great job, team. Question number 11. Which type of diet is recommended for a patient with difficulty chewing? Is it going to be a regular diet, a mechanical soft diet, a high fiber diet, or a liquid diet? Princess, I see you, Evie. I'm going to pronounce your name right one day. I'm just going to call you Cammie. Judy, Julie, Cassandra, Jackie. Yes, you all have it. It is a mechanical soft diet. So mechanical soft diets include easy to chew foods that prevent choking. Question 12, true or false? A nasogastric tube or NG tube is inserted directly into the stomach. Is that true or false? Think about the prefix, think about the suffix. Chrissy in bold letters says false. So nasal being the nasal cavity, gastric being the stomach. So a nasal gastric tube enters the nostril and then it's advanced down into the stomach. So everybody, this answer is false. So an NG tube is inserted through the nose, down the esophagus, and into the stomach. It is not directly inserted into the stomach. Rather, it passes through the upper GI tract. NG tubes are commonly used for feeding, medication administration, and gastric decompression. So let's talk about that. Let's say we had a patient who had been vomiting a whole bunch, and we know how tiring, how hard it is for patients who are vomiting. So the doctor will sometimes order a nasal gastric tube, and the nurse will connect that to suction, a really gentle suction. So instead of the person vomiting out that excess fluid, the nasal gastric tube will gently remove it over time. And so that's what we mean by gastric decompression. We're just getting out all that bad stuff that right now, because your patient's sick, their stomach can't tolerate it. And so an NG tube is short term. An NG tube is short term. A gastric tube, whenever they go to surgery and they get that tube inserted through the skin directly into the stomach, that is long term. All right, so if a tube is inserted directly into the stomach, it would be called a gastrostomy tube or a G tube and not an NG tube. So I hope you understand the difference. And if not, get pen and paper and take notes. An NG tube through the nose, short term. A gastric tube directly through the stomach, that one is for long-term feeding. Yes, and so they may also call it a PEG tube. You're absolutely right. All right, so question number 13. When using a feeding pump, the CNA should monitor for A, the rate and any signs of patient discomfort, B, changes in feeding formula, C, adjustments in tube length, or D, frequent patient repositioning. Couldn't trick you. I'll wait for about 5 more responses. So 5, 4, 3, 2, and everybody chose A. Give yourself applause. So the rate and any signs of patient discomfort. So when you come in and you get your report and Nancy, the offgoing CNA, is like, hey, Miss Lucas in room 305, she has a tube feeding. And one of the questions you may want to ask is, what's the rate? Because if it's a high rate versus a lower rate, that is going to indicate that your patient may start having intolerances, because imagine you getting fed a whole bunch of food, but if you're not moving, it can just sit on your stomach. So, and then sometimes your nurses will increase the rate. So we like to communicate and let you know what's happening. So that way, if I increase the rate and you're unaware, but my patient starts having issues, you can at least be looking out for that patient. Like, hey, Eunice, she's saying her stomach hurts. And I'll be like, okay, Tasha, thank you for letting me know. I'll be in there shortly. And that's when I go in and check the residuals. I listen to the stomach, and then I will let the doctor know that, hey, she may not be tolerating this. We probably need to slow it back down again. So you communicate with me, I communicate with the doctor, and we work together to help keep our patients safe and healthy. Question 14, which of the following is the most common reason a patient would require a gastrostomy tube, a G tube, or as Jackie said, a PEG tube? Is it A, the patient has mild nausea and occasional vomiting? B, the patient needs emergency gastric decompression due to an intestinal blockage? C, the patient prefers a G tube over oral eating to avoid chewing food? Or D, the patient has difficulty swallowing due to a medical condition? And no, I don't answer phones, so I know y'all hear that phone ringing, but not today. I'm here with my babies. We're doing our quick review on G tubes, feeding tubes, and nutritional issues. So everybody, the answer is going to be D. So think long term. So who would have a gastric tube? Maybe a cancer patient, somebody who maybe had throat cancer, a patient with a tracheostomy. Sometimes a patient with a trach, they can. I probably shouldn't tell you that answer because that's the question, but you're going to figure out who can have foods and who can't. So I'm just going to shut up for now and just read this screen because I don't want to give you any answers in advance. So a G tube is placed directly into the stomach for long-term. Enteral is another way of saying when they're not being fed via mouth. So enteral feeding in patients who cannot safely swallow or consume adequate nutrition by mouth. Conditions that commonly require G-tube include stroke, neurologic disorders such as Parkinson's disease, head and neck cancers, or severe developmental disabilities. Think about those babies, the preemies. So gastric decompression in emergency cases is usually done with an NG tube, not a G tube. Question 15, a CNA should report which symptom in a patient receiving enteral nutrition? Would it be loose stool, B, no bowel movement in 3 days, C, normal bowel sounds, or D, sleeping through the feeding? Which do you think is the most serious? Which should you report to the nurse? And Sherlyn and Aaliyah and Naomi and Princess and Judy and Laura and Laventa. Hi, it's a lot of you all. Yes, you have it. It is B. And so I know it's kind of tricky. You was like, should I report A? But it is going to be B. If they don't have any bowel movements for 3 days, that's going to indicate constipation. It could be a bowel obstruction, or maybe they are not tolerating that feeding. So that could lead to discomfort, impaction, which is when the constipation becomes so severe until we can't get the stool to be moved by normal measures, which would be fluids. It would be maybe a laxative or suppository. Sometimes your nurse will have to glove up and put lube on her finger and then go in there and disimpact manually. So if you are a CNA, you should report lack of a bowel movement to the nurse, because that could mean that the patient's feeding regimen needs to be changed. And the reason why you wouldn't report the loose stools is because the stool should match what goes in. And so this person's only receiving fluids. So we're not expecting solid bowel movements. We're expecting loose bowel movements, but not diarrhea. So a patient having 1 or 2 loose bowel movements a day because they're on tube feeding would be normal. A person who is saturating your bed repeatedly with loose bowel movements, that is called diarrhea. That is something you want to let your nurse be made aware of. All right, so true or false? A patient with a feeding tube can never consume food orally. What do you think, team? A patient with a feeding tube can never consume food orally. Oh, you all are slower to answer this one. Revealing the answer in 5, 4, 3, 2, and yes, you are right. The response is false because some patients with feeding tubes may still be able to eat by mouth if their swallowing function is intact and approved by a healthcare provider. So they would have a swallowing evaluation. So some people may eat for pleasure, but they get their nutrients via their gastric tube. So you may see a patient who may take small amounts of food via the mouth just because they like the flavor or they want something cold, but because they're conditioned, they cannot take in enough nutrients in order to meet their dietary requirements. So this route would just be for pleasure, and the gastric tube will be to make sure they're getting enough calories. Okay. All right. Question number 17. A patient with dysphagia should eat foods that are A, dry and crumbly, B, moist and cohesive, C, sticky and tough, or D, large and chunky. And I hope you all are having a wonderful day and that you're studying for your test. I know you're going to do well. We get so many emails and phone calls from students who have just been watching our videos and passing their exams. So we expect the same from you. And if you chose B, you have it. It is moist and cohesive. Think about those mashed potatoes, or think about maybe like Salisbury steak that has gravy on it, because those foods are easier to swallow and thus reduce the risk of aspiration. Question number 18. A major risk of tube feeding is A, increased appetite, B, weight gain, C, aspiration pneumonia, or D, muscle cramps. This one's tricky. I see a lot of B's, I see a lot of C's. And so we'll reveal the answer in 5, 4, 3, and yes, you have it. It is C, aspiration pneumonia. And so if the formula enters the lungs, it can cause a serious infection. So I just talked about this formula that is replacing this person's caloric needs. So that means it has sugar, it has protein, it has calcium, it has all the good stuff for your gut. But now if they vomit, or if they have acid reflux and they bring it up, and when it goes down, it enters the trachea and then the lungs, your lungs they don't need to have all of that in it. So now we have a breeding ground for bacteria. And whenever someone aspirates and then develops pneumonia, we call that aspiration pneumonia, because that is caused by what they actually ate, what was being given to them enterally. What a lot of your facilities will do is they will actually add a dye into the tube feeding. And then that way we know if we see this green color, not necessarily green, it could be blue, we see a different color fluid coming out of their mouth, that would give us an early indication that this patient probably aspirated, so we can get those chest X-rays done a little bit faster. So every facility is different, but some facilities do add a food coloring to the tube feeding. Okay, so you'll be aware of that. Question 19. A patient with a tracheostomy should be closely monitored when eating orally due to the risk of aspiration. Is that true or false? And then what is a tracheostomy? True or false? A patient with a tracheostomy should be closely monitored when eating orally due to the risk of aspiration. All right, Aaliyah says true, Naomi says true, Judy and Tori and God First says true, Jude Lynn says true. So you're absolutely correct. Everybody, a tracheostomy is that artificial airway that goes into the trachea. And yes, sometimes after they have gotten out of their acute medical state, your patients will have an evaluation. And even though they have a trach, they're still going to be able to eat. Of course, you as a CNA, if you're in the room with them, you're going to have to monitor them closely. So patients with tracheostomies are at a high higher risk of aspiration because the normal swallowing mechanism may be altered. They have a tube in their throat. Foods or fluids can accidentally enter the airway, leading to choking or aspiration pneumonia. The CNAs and nurses must monitor these patients closely and follow the dietary modifications, such as honey thickened liquid. Make sure it's at the right consistency, and the swallowing precautions recommended by the healthcare team. So, yes, patients with tracheostomies can also eat. Sometimes. Question 20. What is the primary difference between bolus and continuous enteral feeding? That's a lot to read, so I'm going to let you read it, and we'll resume in about 20 seconds. You can start putting your answers in the chat. I am so proud of you. You make me want to sing. What? I'm so proud of you. You got the answer right. So, A, bolus feedings deliver formula in larger amounts at set times, while continuous feedings provide a steady flow of formula over several hours. And here's the rationale. Bolus feedings involve, we just said that, it mimics normal meal patterns. That's what we're talking about, the bolus feeding. And it's commonly used for patients who can tolerate larger volumes of formula at once. Continuous feedings provide a steady and controlled flow of formula over a longer period of time, usually using a feeding pump, such as when you're in the hospital, your patient may be fed from 7 a.m. until 7 p.m., but then we stop the feedings at night. The continuous feeding is ideal for patients who have poor tolerance for large volumes at once or have a higher risk of aspiration. I am so proud of you. Question 21. A patient receiving a bolus feeding should be monitored for which complication? Would it be increased energy levels, hypoglycemia, hyperglycemia, or increased urine output? Think about all of that nutrients and stuff, for lack of a better term, that I told you would be mixed into the tube feeding. So what do you think your patient would be at risk of having? Now, increased energy levels is not a bad thing. So, yes, if you're being fed, you're going to have increased energy levels. That would be the goal. So, give me an answer that is not A. Because we said a complication, not a benefit. So, a complication of you being fed would not be increased energy levels. So everybody, revealing the answer in 3, 2, and I do see a couple of correct responses. So if I am giving you a whole bunch of formula at one time, aka a bolus feeding, that means that your sugars could spike. It's like having a whole container, it won't be this large, of a sugary substance at one time. So hyperglycemia, whenever your patient's on a tube feeding, don't be surprised if that's within your scope of practice at your facility. If your nurse requires you to check the blood sugars every 1 to 2 hours when the feeding is first started. And that is because we're trying to make sure that their sugars don't spike way up. So patients receiving bolus tube feedings are at risk of high blood sugar because a large volume of formula is being delivered quickly, thus leading to a rapid increase in glucose levels. Many enteral formulas are high in carbohydrates, which can cause spikes in sugar, particularly in patients with diabetes or impaired glucose metabolism. Question 22. A patient with a PEG tube who is showing signs of dehydration should be monitored for A, increased skin moisture, B, excessive sweating and increased blood pressure, C, weight gain, D, dry mouth, dark urine, and low blood pressure. So the fact that we mentioned PEG tube was just a distraction. A patient with signs of dehydration regardless of what tubes they have. What should they be monitored for? And yes, everybody, it is D. So those are the common signs of dehydration, which can occur if fluid intake is inadequate in patients on enteral nutrition, but in all your patient populations, you should be monitoring for that. Question 23, a pleasantly confused, so not the one who's trying to beat you up, a pleasantly confused patient has accidentally pulled out their G tube. While waiting for the nurse to enter the room, what should you do? Is it A, cover the site with a clean, dry dressing and notify the nurse immediately? B, try to reinsert the tube to prevent the site from closing? C, leave the site open to air and continue assisting the patient with their activities? D, apply firm pressure to the site to stop any drainage or leakage and notify the nurse immediately. I know you're torn between A and D, but I'm going to teach you the difference in 5, 4, 3, 2, and ouch, don't apply firm pressure. That's going to hurt. So it is A, you're going to cover that site with the dry dressing. The nurse is on the way. Remember, they just pulled a tube out of their stomach. So they may not be bleeding. If they were bleeding, but it didn't say that, you could apply a little more pressure, but their stomach's going to hurt if you really start pressing in there. So a G-tube site can begin to close quickly, sometimes within hours, which can make reinsertion difficulty. The CNA's priority is to protect the site from infection and leakage by covering it with a clean, dry dressing and report the incident immediately. So the nurse or provider will determine the next steps, which may include reinsertion, reinserting a new tube, or assessing the patient for complications. So you get the nurse in there. Usually it's not a whole bunch of blood, but it's going to be scary when you see it. But it is not something that is, how should I say it, that's going to be really complicated, where the patient wouldn't be able to heal from it quickly. We literally just go back in and reinsert a new tube. And so that can be done in a matter of minutes or a matter of hours, depending on what the facility's protocols are. Question 24, a tube feeding pump begins to alarm while a CNA is assisting a patient. Which of the following are common reasons for the alarm? Is it A, the feeding formula has run out or the bag is empty? B, the tubing is kinked or clogged, blocking the flow of formula? C, there is air in the line, which the pump has detected? Or D, the pump battery is low or the settings need adjustments? Or E, all of the above? I tricked you. Yes. You all have it. It is E. So when that pump is beeping, you just go in and you just starting from the patient. You start checking, all right, and check your way all the way up to the machine. And if it says air is in the line, well, that's not a CNA duty. That is a nurse's duty. If the tube feeding has run out of formula, that is not a CNA duty. That is a nursing duty. However, if the tube feeding, if the line is kinked, maybe your patient has turned, or maybe it has disconnected because your patients are Houdinis and they do things in the bed like turn and they have this whole line of food, that is something you can correct, okay? So you'll figure out what your duties are, which are separate from the nurse's duties. Question 25. A patient receiving tube feedings complains of diarrhea. What should the CNA do? A, are you going to stop the feeding? B, are you going to encourage the patient to drink more water? C, are you going to ignore the complaint since diarrhea is expected? Or D, are you going to report the diarrhea to the nurse for evaluation of feeding intolerance? And I know you all are geniuses, and I know that you know the answer, so I'm just going to reveal it. In 3, 2, and yes, it is D. All right, so you're going to report the diarrhea because diarrhea can indicate formula intolerance, infection, or feeding rate that is too fast, requiring nurse intervention. And don't forget that not all diarrhea is caused by this formula. Notice in the rationale, we mentioned infection. So your patient could have C. diff. So if a patient has diarrhea, you're in there cleaning them more than twice per shift, I would let the nurse be made aware so we can go ahead and get a stool specimen, send it off to lab, and figure out what is growing in their GI tract. Question number 26. What diet is most appropriate for a patient with hypertension? So yeah, you have 15 patients, and we are going to stop talking about the patients with the G tubes. All right, so would it be a high sodium diet, B, a DASH diet, C, a ketogenic diet, or D, a high fat diet? And this one may be a new term for some of you all, but looks like Priya has it. So you all, let's learn a new term together. The DASH diet stands for Dietary Approaches to Stop Hypertension. So say it with me. Dietary Approaches to Stop Hypertension. That is the DASH diet. So it is low in sodium and rich in fruits, vegetables, whole grains, and all of that together helps to lower the blood pressure. And don't forget that things like beets, can also help to lower the blood pressure. So if you know somebody is on a cardiac diet and they're having blood pressure issues, but you see those beets uneaten, you probably want to recommend that, hey, why don't you just try a few? I hear they work well for your blood pressure. It can lower it. Question 27. What type of diet is recommended for patients with diabetes? Is it going to be a low protein, high fat diet, B, a high sugar diet, C, a low glycemic, balanced carbohydrate diet, or D, an all liquid diet? That was a lot to say. But yes, Tori and Elizabeth and Chantel, you all have it correct. Looks like Julyn and Cassandra, if you chose C, low glycemic, balanced carbohydrate, and I will explain that to you shortly. So whenever we have a diabetic patient, remember that those carbohydrates turn into sugar. So we need to control the carbohydrate intake, focusing on low glycemic foods and maintaining balance, which means that they have protein and carbs, just not a whole bunch of carbs during their meals. That's going to help regulate the blood sugar level. So when we say low glycemic, that refers to foods that have a minimum impact on blood sugar levels after being consumed. Something like nuts. If you're eating nuts, they don't have a whole bunch of sugar. But if your patient eats ice cream, well, that would have a lot of sugar, which means it would be referred to as high glycemic, not low glycemic. Question 28. Which food should a patient with chronic kidney disease limit? Would it be bananas, rice, bread, or chicken? And the only hint I will give you here is that they can't excrete potassium. So they should not have a whole bunch of potassium-rich foods because too much potassium can cause cardiac arrhythmias or cardiac arrest. So which of the food choices there contains potassium? Revealing the answer in 3, 2, and you got it. They cannot have bananas or pretty much anything that you see there. So bananas are high in potassium, which can be dangerous for patients with chronic kidney disease who have difficulty regulating their potassium levels. I hope this is a good review for you all. So if you all are enjoying the video and you stayed this long, give us a thumbs up. We are so close to having 1 million subscribers. We should reach that mark in 3 months. So if you haven't already subscribed and you've been hanging around now for 28 questions, go ahead and hit that subscribe button. Help a nurse out. Remember, I'm Nurse Eunice, your favorite nurse tutor. Question 29, everybody. Question 29, a patient with celiac disease must avoid, would it be dietary products, fruits high in vitamin C, leafy green vegetables, or gluten-containing foods? And you'll learn more about celiac disease on the next slide. So revealing the answer in 5, 4, 3, 2, and everybody got it right. It is D, gluten-containing food. So celiac disease is an autoimmune disorder where gluten triggers damage to the small intestine. CNA should watch for frequent diarrhea, bloating, gas, all of those GI symptoms that a patient would have, including unexplained weight loss, fatigue, pale skin, and an itchy rash. And you're like, oh my God, why do I have to know so much as a CNA? Because you spend more time with the patients. So if a patient has a gluten allergy and you think they ate something, you should be letting the nurse know. So some patients may also experience mood changes or irritability. If a patient has celiac disease, CNA should ensure that they receive a gluten-free diet. Make sure they get the right tray, you all, and you're going to report those stomach issues or weight loss to the nurse. And be mindful of cross-contamination risk. So in some of your assisted living facilities, let's say today you're on kitchen duty or you're in a group home setting, and so you're fixing some items, and let's say it has some nuts or something that this person shouldn't be eating, and then you use that same utensil in order to fix a salad that has like green leaves. Well, you are now cross-contaminating, and your patient may not be able to tolerate the food that you prepared for them because you didn't clean your utensils or use separate utensils. So be mindful of the cross-contamination risk also if you assist with the meal preparation. And here are some common foods that contain gluten. It would be pasta, noodles, bread, couscous, I hope I pronounced that correctly, pastry and baked goods, crackers, cereals, gravies, and beer. So your patients who cannot have gluten should not have these items on their tray. So you just watch out for that whenever dietary delivers their meal. Question 30. Which nutrient is most important for a patient recovering from surgery? Would it be carbs, protein, fats, or sodium? What does a person need to heal? Do they need carbs, protein, fats, or sodium? Round of applause. Yes, you all got it right. They need protein. So the answer is B. Protein is essential for tissue repair and wound healing post-surgery. Question 31. A patient with iron deficiency anemia should be encouraged to eat, would it be citrus fruits, high sugar foods, processed snacks, or lean meats and leafy greens? In other words, which of those items has more iron? Yep, you got it. It would be D. So some of you all have like gotten 100% on this practice test, and I am loving it. So iron-rich foods like meat and leafy greens help to replenish iron stores and improve red blood cell production. Question 32. What is the primary dietary concern for a patient with heart failure? Would it be high fluid intake, high fluid and sodium intake? Would it be low sodium intake or increased sugar intake? So when someone's heart is failing, what shouldn't they have? We're torn between B's and C's, and I think it's because of the way the question is worded. So a dietary concern, like something they shouldn't have, should they not have high fluid and sodium intake, or should they not have low sodium intake? Reveal the answer in 3, 2, and remember that Fluid follows the salt. So if they're eating a whole bunch of processed foods, and on top of that, they're drinking a whole bunch of water, or they're having a substance like a Coke or a Pepsi that is a soda that has sodium in it, they're going to start to swell. Remember, when someone has CHF or congestive heart failure, their heart isn't able to pump properly. So the fluid just backs up, and it can back up in their legs and also into their lungs, so they can have like coarse lung sounds. So for them, a dietary concern would be that they should not have the excess fluid or sodium, because they can start retaining it and worsen their heart symptoms. So most of the time, those patients are going to be on daily weights. And as a reminder, whenever you're weighing a patient, usually do so first thing in the morning, after they have used the bathroom, but before they have eaten or drinking anything. Question 33. What diet modification is recommended for a patient with osteoporosis, so the weakening of the bones? If somebody has weak bones, should they have a high protein, low calcium diet, a low fat, low sodium diet, a high calcium, vitamin D rich diet, or low fire, high carbohydrate diet? Whew. I need to drink some water after saying all that. And you all are rocking it with this one. I think this is like the best test where I've seen like most of you all get the answers right. I am so proud of you. It is C. So calcium and vitamin D rich foods are essential for bone strength and preventing fractures. And don't forget that your patients can also get vitamin D by going outside and getting some sun. So if your patient is wheelchair bound, put them in the wheelchair if you can and get them outside. Let them get some sun exposure, to their tolerance. You don't want them getting a sunburn, but maybe 5 to 10 minutes. That's going to improve their mood, but it's also going to help build their bones. All right, question 34. A patient with diverticulitis should initially follow what type of diet? Oh, hold up. I'm trying to get to it. Everybody, Cassandra passed her exam yesterday. Congratulations. We are so proud of you. All right, so back to this question, everybody. All right, so a patient with diverticulitis should initially follow what type of diet? Would it be a high fiber diet, a keto diet, a high protein diet, or a low residue, low fiber diet? Diverticulitis, something is inflamed. Itis, it is inflamed. What would be the best diet for somebody with GI inflammation? Ooh, some of you all, you're so close. Remember, let's say they have high protein. You know how much acid has to be produced in order for them to digest oxtails and beef and chicken and pork. So let's do something that is low residue. It is D. So a low residue diet reduces the strain on the digestive system, helping to prevent irritation during flare-ups. So patients with diverticulosis or diverticulitis should avoid low fiber, processed foods, red and processed meats, high fat, fried foods, carbonated drinks. They can't have any of the fun stuff because the fun stuff is going to irritate their stomach. They may also need to limit nuts and seeds, which can get stuck, and also popcorn, but some research is mixed on that. So low residue would be the best for them. Question 35, and we're going all the way to 50. So I hope you can stay and watch the whole video with us. But question 35, oh, Gwendolyn, thank you. You all make me so happy. Thank you so much. I appreciate you. All right, so question 35. What diet is most appropriate for a patient with gallbladder disease? Is it going to be A, a high fat diet, B, trying to get these right. There we go. I apologize, you all. Is it going to be a high fat diet, a high sugar diet, a low fat diet, or a high calcium diet? What is the most appropriate for a patient with gallbladder disease? So all that bile, which one would not cause an increase in bowel production? Which one won't cause their pain to worsen? And if you chose, that's right, a low-fat diet. Give your stomach time to rest. Stop eating all the junk food. So reducing fat intake minimizes gallbladder irritation and helps to prevent bowel buildup. So it is so crazy whenever your patients come and they have their gallbladder disease, and it's like if you ask them what did they eat, like, okay, so what did you eat before you came to the hospital? And it's going to be like the 4th of July meal. It's like, oh, I had some steak and I had baked beans and so they ate a whole bunch of fatty foods that caused the bowel to be excreted, which caused their symptoms to be worse. And so sometimes they can actually delay surgery where we don't have to remove their gallbladder if they can just change their dietary habits. So diet is so important. Sometimes we can heal ourselves just by changing what we eat. Question 36, which nutrient should be restricted in a patient with liver disease? This one's hard. Is it going to be protein, carbohydrates, fats, or sodium? What should be restricted in a patient with liver disease? And so our liver diseases are, we have hepatitis, we have cirrhosis. Some patients could actually have liver cancer. So if you are taking care of somebody who is jaundice, maybe their skin or their sclera is yellow, they shouldn't have which type of item on their tray? And I see some correct answers. It's going to be D. So the high sodium can cause fluid retention and worsen liver disease complications. So they are going to be on a modified diet also. Remember, with cirrhosis, their liver is swollen, and so we don't need to cause any additional swelling or pain. So, and as I said before, fluid follows salt. Question 37. A patient with GERD or I can't even think of it right now, reflux disease should avoid what? Is it going to be lean meats, spicy and acidic foods, whole grains, or water? So gastrointestinal reflux disease, I do apologize. What should they avoid? Yep, and you got it. It is B. So no, she can't have hot sauce. So those foods can increase acid production and worsen reflux disease. And those kids who eat the Takis and those spicy chips, they're going to start having stomach upset. They shouldn't have GERD, but those foods were so spicy until it can cause an increase in acid production, aka GERD, even in the younger population. So let's be mindful of what we're allowing our kids to eat. Question 38. A patient in a hospital setting begins choking on food, but is still coughing forcefully. As a CNA, what is the best initial action to take? A, immediately perform abdominal thrust, aka the Heimlich maneuver. B, lay the patient flat and check their airway. C, encourage the patient to continue coughing and monitor closely. Or D, offer the patient water to help clear the obstruction. So the patient is choking, but they can still cough. What do you do, CNA? And yes, I'm so proud of you. Our patients are in good hands. It is C. So if someone's coughing, you encourage them to cough. They don't need the Heimlich maneuver right now. So if a patient is forcefully coughing, it means the airway is partially obstructed. It is not fully blocked. So coughing is the body's natural defense to clear the airway. So it is best to encourage them to continue. Intervening too soon with abdominal thrust may force the object deeper into the airway. You should stay with the patient, monitor their breathing, and be prepared to act if the obstruction worsens. And of course, if you're in the hospital, press that button, get the nurse in the room. But let's say you're in a home care setting, so have your phone nearby, but you're going to encourage them to cough. And don't be afraid to call 911 Or if maybe after this situation has, transpired, go ahead and call that nurse so they can come out and do an emergency visit just to check on that patient to make sure they don't have any symptoms or have a reoccurrence of this choking episode after you leave and you're no longer on the shift. Question 39. While assisting a resident in a nursing home, you notice that they were choking and now they are unresponsive. What should you do after calling for help? A, perform a blind finger sweep to remove the obstruction. B, hit the patient in the back and wait for the nurse to give further instructions. C, attempt abdominal thrust while the patient is laying down. Or D, begin chest compressions immediately and check for the obstruction between the sets. In other words, look in the mouth whenever you're going to give a breath. What do you think the best response is? A choking victim is now unresponsive. Think about your last CPR or your last BLS class. What do you do? And we are torn between C's and D's, but the D's have it. If a choking victim becomes unresponsive, they've lost oxygen and now their heart is also starting to die, the heart muscle. So we need you to put them on the ground and go ahead and start those high quality chest compressions. You're going to start CPR because they are likely in cardiac arrest. And no, that is according to the American Heart Association guidelines. So we're going to start CPR immediately with chest compressions. Remember, you don't have to give breaths, but if you do decide to give a breath, know that the breath may not result in chest rise because they have an obstruction. So after your 30 compressions, open up the airway using the head tilt chin lift maneuver, and you would look in the mouth. If you can see the obstruction, you would do a finger sweep if you can see the object and remove it. If you don't see the object, don't go in there and blindly trying to get something out because you can push it down further. You just keep on doing those chest compressions until your healthcare team comes, because they have scopes, they have things that they can look into the throat area with, or they can also do an emergency tracheostomy. So, but you're just the first line until those other advanced workers get to the scene. So keep doing your good job and do the CPR. Question 40. A nursing home resident has broken and jagged teeth, making it difficult for them to chew. As a CNA, which dietary modification is most appropriate for this patient? Would it be A, regular diet with extra fluids to help with swallowing? B, pureed diet to ensure food is soft and easy to consume? C, mechanical soft diet with small bite-sized pieces of food? Or D, high fiber diet to promote digestion and prevent constipation? Now, I will accept two answers here, but we usually do things in stages. So would we want them to have a pureed diet or a mechanical soft diet? Revealing the answer in 3, 2, and we would start off with a mechanical soft diet because you all are going straight to pureed food. Like, look, he got jagged teeth. But usually it's going to be like a little transition. So we're going to try them on mechanical soft. And if they're still having difficulty, that's when the speech therapist, the doctor, will decide that, hey, this patient needs a pureed diet. But a mechanical soft diet is the best choice for patients with broken or jagged teeth because it includes soft and easy to chew foods that require minimal effort to break down. This diet typically includes mashed, ground, or finely chopped foods like scrambled eggs, soft vegetables, and tender meats. Question 41. What type of diet is recommended for a patient with peptic ulcer disease? And you know this. Would it be spicy and acidic foods, high caffeine diet, a high fat diet, or a bland, low acid diet? And I think I've drilled this into you enough. So anytime you see on the chart where a patient has like gastric reflux or peptic ulcer disease, I know that you're going to be looking to make sure that they're tray has nothing that's going to irritate their stomach lining. So they should do D. They're going to avoid spicy and acidic foods to reduce the stomach irritation. Question 42, an elderly patient in a nursing home is at risk for muscle loss and slow wound healing. Which of the following foods is best for maintaining muscle mass and promoting tissue repair? Would it be applesauce, chicken breast, white bread, or jelly? Aaliyah. All right, so for this one, everybody, we are torn. We have some C's and we have some B's, but remember, anytime that we're trying to heal, we need protein. So which of those items has protein? And if you chose B, chicken breast, you are right. So chicken breast or protein is essential for muscle maintenance, wound healing, and immune function in elderly patients. Applesauce and jelly are mostly carbohydrates with little protein, and white bread lacks the necessary protein content. So elderly patients should consume adequate protein to prevent muscle loss and delayed wound healing. And don't forget that if they don't want to eat it, they can drink it. We have supplements that have protein added to them. We can also add protein to pudding. So there is no reason that your patient should not be. You all are blessing me so much today. Laura, oh, I love you all. Thank you all so much. All right, so question 43. You all are trying to make me cry, and I got to get through this video. So I appreciate you all. 43, an elderly patient complains of frequent constipation. Which of the following foods would be best to help regulate their bowel movements? Would it be oatmeal, mashed potatoes, cheese, or white rice? Constipation. What do they need? No problem, Miss Benita. I know, depending on where you are, and then the video has a little lag. So, all right. I think everybody has it. So Jacqueline, Chris Love, Laura, Maram, Hawa, Tabitha. So not the processed one, but the good old-fashioned oatmeal. So it's going to be A. So oatmeal is high in fiber, which promotes healthy digestion and prevents constipation. So, and constipation is a common issue in elderly due to reduced mobility and the side effects of medications. And so while rice and mashed potatoes do have fiber content, it's not enough to promote the bowel movements. And then for some patients, cheese is going to cause constipation. So encouraging fiber-rich foods like whole grains, fruits, and vegetables, along with water. Because if you only give them fiber, if you just gave them oatmeal and you don't give them any fluids, that's going to constipate them too. So the fiber is going to bulk the stool up, and the water is going to help flush out that fecal matter. And that's going to help promote their bowel movements. Question 44. What is a major dietary concern for a patient undergoing chemotherapy? Would it be A, a high-fat diet, B, excessive sugar intake, C, increased appetite, or D, malnutrition and weight loss? And it looks like Patience and Judy, Tori, LaVenta, Elizabeth, you all have it. So whenever someone's undergoing chemotherapy, they're going to be at risk of malnutrition. They're going to lose weight because chemotherapy causes nausea, vomiting, and appetite loss. As a result, they can lose a lot of weight and lose it quickly, thus be at risk of malnutrition. Question 45, we're almost at question 50. We're doing it, team. An elderly patient is dehydrated and needs a food that provides hydration and essential electrolytes. What food is the best choice? Would it be peaches, crackers, watermelon, or fried chicken? Which of those foods actually has electrolytes and fluid, water? What do you think? Revealing the answer in 5, 4, 3, 2, and yes, queens, yes, kings, you have it, watermelon. So watermelon is high in water content and provides natural electrolytes like potassium, which can also help with hydration. But I want you to notice that the watermelon there has seeds. And so we don't want to fix one thing, but cause another problem. So sometimes they would have the seedless watermelons in your facility, but if you're assisting somebody and you know maybe they have a sight concern or they have a swallowing difficulty, yes, we want to hydrate them with the watermelon, but take out the time to take out those hard seeds because we don't want them to choke on those. Question 46. A nursing home resident with early signs of memory loss asked about foods that support brain health. Which of the following foods is best for cognitive function? Would it be salmon, a baked potato, water, or meatloaf? Which one helps with performance, brain performance? What do you think? Hold up. I'm shedding a little tear because y'all know the answer and y'all got it right. My patients are in good hands with you all. It is A, salmon. So salmon is rich in omega-3 fatty acids. You're so close, Jacqueline. Yes, it's rich in, I'm sorry, I'm doing way too much over here. There we go. Hi. It is rich in omega-3 fatty acids, which support brain health, reduce inflammation, and may slow cognitive decline in elderly patients. I am so proud of you. Question 47, COPD. A patient with COPD may benefit from which of the following? For those of you who do not recall what COPD stands for, it is chronic obstructive pulmonary disease. So this patient is having problems with breathing. So what would they benefit from? Would it be male? I'm not sure because I'm on YouTube. Are you on my Facebook channel? All right, but we're on YouTube. It's Florida Training. All right, so would they benefit from a high fiber, low protein diet, a low calorie diet, a high fat diet, or small, frequent, high protein meals? If you were having a hard time breathing chronically from smoking for so long, what type of diet would you prefer? And if you chose small, frequent, high protein meals, you are right. So smaller meals reduce bloating and support muscle strength. You all, sometimes you're struggling to breathe. They are short of breath, so they can't eat a big meal. It's going to be small meals. So we have to make the meals impactful. And we already mentioned that proteins helps to build muscle, and it also helps to heal. So small, frequent, high protein meals would be best for your patients with COPD. Question 48. A pregnant woman, yes, you're going to be taking care of pregnant women also, because she may not know she's pregnant and she's on your unit. And now we're like, hey, you're having some abnormal symptoms. Let's get a pregnancy test. But she's there for blood pressure issues. So you're going to figure it out as it goes along. But you have a pregnant woman on the med surg floor. A pregnant woman needs more fat intake, caffeine, folic acid, and iron, or high glycemic foods. And Phoenix and Mary and Cassandra and Lily and Michelle and Julene and Gwendolyn and all you got it right. It would be C, folic acid and iron. So these nutrients prevent birth defects and support fetal development. And yes, they can take a supplement, but it's also good to just include foods that include folic acid and iron. Question 49. A CNA is preparing for their state examination. So these last two questions are about you. It is not about the patient, because without you, the patients will not receive the proper care. So I need you to take care of yourselves so that you can take care of others. So question 49. A CNA is preparing for their state exam and wants to eat a breakfast that will help them stay focused and energized. Which of the following is the best choice? So, on the day of your test, are you going to eat a sugary donut and coffee, B, eggs, white grain toast and a banana, C, a fast food breakfast sandwich and soda, or D, nothing, skipping breakfast to avoid feeling sluggish? I'm so proud of you. Please, on the day of your test, don't do D. Yes, I need for you all to have brain food and something that's going to hold you. So it is going to be B. So eating a balanced breakfast before an exam helps to maintain energy levels, focus, and cognitive function. You can even take like some yogurt with you. So yogurt's good also. So the eggs provide protein. The whole wheat toast offers complex carbohydrates, so your sugars don't drop too low. All right. And then a banana provides natural sugars and potassium, which support brain function. So, so yes, please eat on the day of your test. Question 50. CNAs and nurses have a higher risk of developing urinary tract infections, UTIs, due to their demanding work schedules. What is the best way to reduce the risk? Is it A, drink plenty of water and take regular bathroom breaks? B, rely on cranberry juice alone to prevent UTIs? C, hold urine as long as possible to finish work tasks efficiently? Or D, limit fluid intake to avoid needing frequent restroom breaks? And look, you all are the future of healthcare. And as the future of healthcare, I need for you to take care of yourself and your bladder. And you have taken your patient to the bathroom 5 times. Meanwhile, don't do that. Where did you go? You do matter. we need you. So we need you to take care of yourself. And so the best response is going to be A. I need for you to take time out to use the bathroom, you all, to drink some water. So healthcare workers, including CNAs and nurses, often delay urination due to busy shifts, which increase the risk of UTIs. You hold your urine for too long, and that causes bacteria to multiply, and then you end up getting UTI. Can you imagine working a 12-hour shift with a UTI? That is going to hurt. So drink some water. You can add lemon to your water. Try to take your bathroom breaks. Do not go 12 hours and not use the bathroom one time. You are human and you need a break. And then don't forget those hygiene practices. I know I shouldn't have to tell you this, but we wipe from front to back. And then you also need to wear breathable underwear. You all, thongs and scrubs are not a good idea. Wear some regular old white underwear that is breathable so that you don't get a UTI. And that is it, everybody. As you know how we end every one of our videos, caring CNAs become caring nurses. And my job is to help you not only pass your CNA test, but to help you become a nurse or whatever it is that you desire to become. So I appreciate you all so much. And Priya and Jackie and Chrissy, you all are so welcome. And we're so close to 1 million subscribers, you all. So thank you all for being awesome. Oh, so Mrs. Saskia, our translator who translates our videos into Haitian Creole, she will be on Saturday. But my schedule is just really busy right now, so I can only come on once per week. But I have videos like lined up for you all. So I look forward to seeing you all in the next video. And I think the next video will be on cardiology and pulmonary diseases. So I will see you next week. I love you all. And thank you for the super chats. Thank you for the necklace. You all are just amazing. Keep being a blessing to others. And I will see you all next week. Bye.